Good morning, everyone. I'd like to start by saying thank you to California's Surgeon General, Dr. Burke Harris, and Sal Arias, who is the MTSS coordinator in Kern County, for joining me today to discuss the impacts that childhood trauma has on our later health and what we here in California are doing to mitigate some of these effects. As some of you know, this year, one of my bills, Senate Bill 428, the ACES Equity Act, was signed by Governor Newsom. The COVID-19 pandemic has been challenging to everyone when it comes to mental health, but it has been especially hard on our children. And many children have seen without regular interaction and play, have been out of school or attending inconsistently, and it has been a really scary and uncertain time for them. The bill I introduced, SB 428, expands access to benefits that screen for adverse childhood experiences, also known as ACEs, and will help provide early integrated care to children who have experienced traumatic effects, like the pandemic, helping to prevent future health issues. I am proud that California is taking such a bold step forward in continuing the care we provide to our children, especially now that we know how interconnected our childhood experiences are to our behaviors and health as adults. SB 4208 reinforces California's commitment to improving access to adverse childhood experiences. I'd like to introduce California's first Surgeon General, Dr. Nadine Burke Harris, and Sal Arias, who are joining us today to discuss childhood adverse experiences more in depth, as well as what the state and the counties are doing to combat them. Dr. Burke Harris has dedicated her career to serving vulnerable communities, and after completing her residency at Stanford, she went on to found a clinic in one of San Francisco's most underserved communities. She is also the founder of the Center for Youth Wellness, an organization that is leading the effort to advance pediatric medicine, raise public awareness, and transform the way society responds to children exposed to adverse childhood experiences and toxic stress. Salvador Arias is the MTSS coordinator with Kern County Superintendent of Schools Alternative Education Program, but wears numerous hats, including school site administrator, Safe Schools, and others. He is a Marine Corps veteran who has worked for Kern County Probation, has a bachelor's degree in psychology, master's in social work, licensed clinical social worker, pupil services credential, and administrative services credential. Salvador has over 14 years of experience in gang prevention, working with foster youth and parent education. Thank you both for joining me today. I look forward to a great conversation about ACEs, and I believe we have Dr. Nadine Burke Harris here to speak.
Thank you so much, Senator Hurtado. And I have to say this, I'm very, very grateful to the governor and the legislature for the passage of SB 428. Thank you so much. It's really incredibly powerful. What we know is that SB 428 will significantly expand coverage for ACE screening beyond just our Medi-Cal beneficiaries. So California was the first state in the nation to provide reimbursement for our healthcare providers for screening for adverse childhood experiences, and to provide investments to train healthcare providers on how to screen and how to respond with evidence-based interventions. And now SB 428 expands that access to all Californians and not just Californians on Medicaid. And we know that's incredibly important because adverse childhood experiences don't just happen in certain zip codes. They don't just happen to in the families of Medicaid beneficiaries, but really they happen to all of us, right? When we look at the original adverse childhood experiences study that was conducted by the CDC and Kaiser Permanente now over 2 decades ago, what that research showed us was that 2/3 of individuals have experienced at least one ACE. Here in California, 62% have experienced at least one adverse childhood experience, and 16% have experienced 4 or more. And we know that happens in every zip code, every neighborhood, every community, every race and ethnicity. And And so this is incredibly, incredibly important. What we also know is that exposure to these stressful or traumatic events in childhood without adequate buffering interventions can lead to prolonged activation of our biological stress response, something that is known as the toxic stress response, right? This prolonged activation of our body's stress response. And that can lead to changes in the way a child's brain, immune system, hormonal system develops, and even changes to the way our DNA is read and transcribed. And really, these changes are what leads to the dramatic increase in risk for stress-related diseases and cognitive impairment. We know that 9 out of 10 of the leading causes of death in the United States are strongly associated with adverse childhood experiences. Everything from heart disease, cancer, stroke, chronic lung disease, to depression, Alzheimer's, and suicidality. And so also what the research tells us is that early detection and early intervention improves outcomes. And SB 428 allows for early detection so that healthcare providers can do that early and evidence-based intervention for all of our communities. And the time for this could not be more important. Unsurprisingly, ACEs have been on the rise during the pandemic, as have other risk factors for toxic stress that can hurt long-term physical health. And while the pandemic itself is not, one of the ACE criteria, it's not one of the things that the CDC looked at, obviously, in the original study, it is certainly a risk factor for toxic stress. Because for much of the pandemic, we've been cut off from our daily sources of support and, for some, our social interactions, while we have all been exposed to significantly increased levels of stress. And I think that adults who experienced adversity in childhood are at greater risk of having developing health conditions with subsequent stressors like this big pandemic. So we know, as all of us go through this incredibly stressful time, those of us who experience ACEs in our childhood are more vulnerable to the effects of the current stressors that we are all experiencing because of the COVID-19 pandemic. And then that can lead to higher rates of stress-related disease as well. So we recognize that the pandemic is greatly exacerbating our risk for stress-related health conditions. And we also know that the fastest way to end this pandemic is for everyone to get vaccinated. I'll tell you, as a pediatrician, a scientist, and a mom, I'm vaccinated. My boys who are old enough to get the vaccine have received it. They're vaccinated. And one of the pieces that I want to encourage folks is that if you haven't already been vaccinated, I really encourage you to talk to your doctor and get vaccinated, because that really is, there's a way that we see these things are connected, right? The pandemic is certainly a pandemic of infectious disease, but it's also driving so many physical, mental, and behavioral health consequences because of the overwhelming stress that it is causing. And so in addition to addressing the adversity, it's really important that we put an end to the big driver of a lot of the stress that many of us are experiencing right now by getting vaccinated so that we can end this pandemic. But we know that even after the pandemic ends, we're going to be facing the long-term after effects, including increased risk of ACEs, toxic stress, and all of the associated health conditions. And so the ACEs Equity Act builds on our existing state efforts as a crucial part of our recovery and response to this pandemic. In January of 2020, California launched the ACEs Aware initiative. Since then, we have trained over 20,000 healthcare providers on how to screen for ACEs and how to respond to toxic stress with evidence-based interventions. All of this available for free at acesaware.org. And now, with the passage of the ACEs Equity Act, more Californians than ever will have insurance coverage for high-quality ACE screening, and that will bring us so much closer to our bold goal of cutting ACEs and toxic stress in half in a generation. So since January of 2020, more than 500,000 Medi-Cal beneficiaries have been screened for ACEs. And just think of what we can do now that many, many more clinicians will be reimbursed for screening. It only takes one ACE screening to change the trajectory of an individual's life. And this legislation has the power to positively transform lives all across California. And I just want to share just a little bit more about the good work that's happening in the community on the ground today. As part of the ACEs Aware initiative, we have invested in not only training clinicians, but also developing networks of care, partnerships between clinicians and community organizations to provide the care that's necessary to support individuals who are experiencing toxic stress. So ACEs Aware has already distributed about $45 million in grant funds to communities across the state, 3.2 million of which is invested in organizations in Fresno County. We are funding local organizations in all throughout the state, working to establish collaborations among multi-sector agencies and expand the network of care to ensure our clinicians, our health plans, our local nonprofits, all are able to coordinate effectively to provide the best trauma-informed care for individuals. And this year, California also is making a historic investment of over $4 billion to transform our youth mental and behavioral health system. It's a once-in-a-generation investment in healthcare, education, public safety, right? When we think about what happens when we have an effective children and youth mental and behavioral health system. And in addition to what we're doing in government, I also want to share that for folks, if you've experienced ACEs, there's an amazing resource called numberstory.org that folks can go to the website and learn about their ACE history and learn some practical resources of what they can do for themselves, or if they have kids, how to prevent handing down your ACEs to your kids. But a couple of the key things that folks can do for themselves, today and every day, are things like exercising daily, right? Exercise really helps to reduce our stress hormones. Things like maintaining good sleep hygiene, because our stress response actually resets itself while we're sleeping at night. And so having good sleep is really important to help to regulate our biological stress response. Having a nutritious diet, and there are actually some specific aspects of the diet that help us to regulate our stress response. Things like mindfulness or meditation, and of course, mental health interventions. So for anyone who's struggling, I want to share a couple of resources. Our CalHope warm line, we have a number of folks can call 1-833-317-HOPE, where you can speak to someone who's been through a lot of the same challenges anytime. Or folks can call the suicide prevention hotline, 1-800-273-8255, or text 838-255 for anyone who is in crisis. Finally, I want to share that for my office created 2 playbooks. The Surgeon General's stress-busting playbook for stress relief during COVID-19, one for adults, but another one for caregivers and kids, which has lots of tips and suggestions. And those are available at the covid19.ca.gov website. And with that, I just want to close and saying, we know that this pandemic has created a lot of stress, anxiety, uncertainty, and frustration. But if there is one silver lining, it's that the resources available to support mental and behavioral health to address the ways that stress affects our physical and our mental health have never been more important. I think there's a great awareness and awakening around that. And I think the ACEs Equity Act is a brilliant step in that direction of getting to our goal where ACEs and toxic stress are cut in half in the state of California. And for that, I want to give my huge and heartfelt thanks to Senator Hurtado, to our governor, and to our legislature for this important legislation. Thank you.
Well, thank you, Dr. Nadine Burke-Harris, really for your help and support on this piece of legislation, but also for everything else that you do. I know there's a whole lot that you do in terms of healthcare for all Californians, not shared today, but I know there is a lot. And so I appreciate everything that you do on behalf of all Californians. And I know that today we'll also be hearing from Sal Arias, and I want to hand the mic over to Sal to give us a little bit more background of what he's seen on the ground.
Thank you, Senator Hurtado, for inviting me. And thank you, Dr. Burke-Harris, for presenting a tough act to follow. But I want to start off by, kind of piggybacking on what Dr. Burke-Harris mentioned. COVID-19, the pandemic, has those qualities to qualify as a traumatic experience. It's affecting the physical and emotional health of individuals. So what leads to what we know as a compounding trauma. So it's trauma on top of trauma. So it's causing fear and illness. It's causing fear of illness to self and others, which is, if you already have trauma, that kind of doesn't help with the sense of safety. Unable to visit loved ones in the hospital, increasing that separation anxiety, isolation, physical and social separation is affecting our mental health. It's causing, Dr. Nadine Burke-Harris mentioned stress. It's also causing that anger, that anxiety, that depression, and even PTSD. That instability, that people need. The stability that people need to address their trauma, that routine, that's being, affected by this COVID-19, loss of jobs, financial stress, which leads to other things like domestic violence. Going to the store, seeing those shelves empty, the negative news coverage that you see on a daily basis about COVID-19. And then a lot of people throughout the state are experiencing bereavement, loss of loved ones. So what can you do? Make yourself aware. We call these the 4 R's. Realize the prevalence and impact of trauma. Recognize the signs and symptoms of trauma. Respond using trauma-informed practices to create a safe and nurturing environment. And lastly, resist re-traumatization. Okay, resist re-traumatization. So, the awareness, Dr. Nadine Burke-Harris mentioned ACEs. Yes, make yourself aware of ACEs, know how they affect us, but also know the signs and symptoms of trauma. Separation anxiety, trouble sleeping, staying asleep, those nightmares, the guilt, anger, and shame, withdrawn, that isolation, fixated on safety and safety of others. Reenact the trauma event through play. You see this a lot in kids. That's why a lot of therapists utilize play therapy, because they recognize that trauma. Difficult concentrating, that foggy brain. You have that foggy brain, anxious or depressed. engaged in risk-taking and self-destructive behaviors, and like Dr. Nadine Burke-Harris mentioned, those suicide ideations. So what are schools here in Kern County doing to support our students who have experienced trauma? First of all, we're all schools throughout the state of California and also here in Kern County, we're working on a system called multi-tier system of support, which addresses the academics, behavior, and social needs of our students, puts those support systems in place. Most schools are providing trauma-informed practices and training to our because again, going to that first R, getting that awareness, creating those lenses in order for people to recognize those signs. There's a lot of need of awareness and training. The schools are also providing that sense of safety, positive behavior support interventions. It's great that schools are doing this because it creates that stability, that safety that people need to avoid re-traumatization, sense of safety. They also have social emotional supports in place at all tier levels. So provide them to all students, to some students, to those few students. So, we need to teach these students how to have these social and emotional skills and coping skills to address their trauma. And also, schools are really hiring school-based mental health staff, school counselors, school social workers, school psychologists, school nurses, really to have those supports in place to support their students who are, again, struggling with those trauma effects. And a lot of schools are also having their own health centers where students and families have that direct access to those health centers. So they're also doing that, and they're doing a lot more, but those are the key components that schools are doing to support students who are struggling with trauma. So other things that parents can do is understand the impact of trauma. Again, going to know what those ACEs are, adverse childhood experiences, the signs and symptoms, also the triggers. What are the triggers? And then be knowledgeable of the resources that are available to you to support your students. Create a safe environment, both physically and emotionally, right? You could do things such as meeting their basic needs, respond, don't react, have those good communication skills with your student. Create routine, that consistency and predictability are very important for those who have experienced trauma. Help them understand and manage their emotion. Teach them how to relax. Understand and manage difficult behaviors. Be patient with your students. Respect and support them. Spend time, talk to them, be present. I heard this great thing said, there's a reason why we were given 2 ears. That means we listen more than we speak. So practice those active listening skills. Help them develop a strength-based understanding of their life story. Reinforce positive things, build their self-esteem. Avoid re-traumatization, like we mentioned. So avoid those negative news that social media, and definitely avoid physical punishment. Seek professional help. Dr. Nadine Burke-Harris mentioned that. Sometimes we need to seek that professional help for our students. And then last but not least, take care of yourself. When you have someone, you're working with somebody that has been affected by trauma and a traumatic event, you can get that secondary trauma effect as well. So you have to make sure you practice self-care. Dr. Nadine Burke-Harris mentioned, taking care of your health, staying healthy, different things that you can do to do this. So make sure you do take care of yourself. Last but not least, I'll leave you with this quote. Life consists not of the aces you've been given, but playing those you are given well. Okay, so make sure that that aces don't determine your outcome. So thank you very much. And thank you, Senator Hurtado, for putting this together. Thank you.
No, thank you, Mr. Arias, for joining us here today. And I know we have a couple of questions in the chat, and I believe Michelle from my office will be asking some of those questions.
Hi, good afternoon. One of the questions is to Dr. Burke-Harris, and it is, apologize for the dog barking in the background. It is, we want to be one of the CBOs, so it's very important to know, how do we get the data from the ACEs screenings?
I'm on mute. So I want to make sure that I understand the question right. So if we want the data overall on how the state is doing with our ACE screening program, I actually just put that in the most recent data report, which is a little older, in the chat. If we're talking about individual data, so individual information about ACEs, then it's really important to recognize that part of the reason that when we do ACE screening in the healthcare setting, it's protected by HIPAA. And that's actually part of the reason why we do ACE screening in the healthcare setting, right? Because clearly some of it is quite sensitive information, and we want individuals, families, consumers, the public to feel protected as they are sharing this information for the purposes of improving their health outcomes, right? And so they're really, we actually created something called the Network of Care roadmap, which is around how community-based organizations can partner with healthcare providers who are screening for ACEs to be able to provide services in a way that both protects patient privacy and also ensures the greatest access to care. So we can put the link to the Network of Care roadmap also in the chat. We'll do that.
Thank you. And that looks like that's the only question we have.
Well, thank you everybody once again for joining us on today's panel. And of course, to celebrate the signing of SB 428, we thank the governor, we thank Dr. Nadine Burke-Harris for being a partner on this. We thank all the individuals on the ground that are trying to help other individuals and children like Sal. And I think all the team and staff that also help move this piece of legislation forward. And with that, this is the end of our call. Thank you, everybody.